Over the years, you find that a huge number of people around the world struggle with their physical, their cognitive, and of course, their emotional well-being. You see a random person walking on the street, and there is a 60% chance that that person is suffering one of these I just mentioned. Well, thankfully, World Mental Health Day, which is celebrated on the 10th of October every year, aims to improve knowledge, raise awareness, and to drive actions that, of course, will promote and protect the mental health of individuals as a universal human right. Now, the 2023 campaign is being commemorated under the theme, Mental Health is a Universal Human Right. Also, there is a clarion call for countries to improve access to quality mental health services and, of course, ensure that the human rights of these people, especially those with mental health issues, are respected. Well, we'll go straight to the conversation now as we discuss Mental Health Day. And to join us have discuss that, we have Salim Wangambi, a clinical psychologist in Accra, Ghana. Of course, we're going to be joined later by Ifeoluwa Yimika as well in Nigeria. Thank you so much, Salim, for joining us.
Thank you so much for having me. Good afternoon to all your viewers and listeners.
Good afternoon to you too. Salim, today is World Mental Health Day. Let's start with the basics. What exactly is the significance of this day?
Every human being has a mental health. And sometimes what happens is that we tend to ignore the mental well-being of people. And not only do we ignore, but people themselves tend to not focus a lot on their mental health. And so a day of this nature is just to remind or serve as a reminder for people to know that you have a mind, and that mind needs to be healthy. Because when anything goes wrong with your mind, it means that the other areas of your life, be it physical, spiritual, social, environmental, could be impeded. So World Mental Health Day is just a day set aside to make all humans around the globe realize that there's a need for us to take care of our mental well-being, to put in place measures and practices that promote it. And this year's theme, like you mentioned, is Our Mind, Our Rights. So it simply means that it's not an option. Like your mental health is not an option or a privilege. It's a right that has been bestowed upon you by virtue of you being a human being. So there's a need for you to demand it.
Right. Thank you so much for that. Also, before we continue, we have Ifeoluwa Yimika Bamidele, a mental health advocate in Nigeria. He's with us now. Ifeoluwa, good afternoon. Can you hear me? Ifeoluwa, please confirm you can hear us.
Yes, I can hear you. It's World Mental Health Day, and I'm happy to be here.
It's great to have you join us as well. Now, Ifeoluwa, one challenge that we face in our continent is the fact that we do not exactly prioritize mental health enough to even provide aid to people in that area, as well as, granting them access to quality care. How can this change? How can we change that?
You're already changing it. You're changing the narrative by having days like this. So some years ago, we've always had the World Mental Health Day, but on a day like this, in different parts of Africa and in my country as well, we've had Nigeria, we've had several programs today reaching out to people, especially those with the young bracket, talking about mental health and how it affects young people. So step one is we have started talking. We have admitted that we need to, the same way we speak about physical health, we need to attend to our mental health and give it attention. So the World Mental Health Day, with its different themes on a yearly basis, directs attention to mental health. So one of the keys is by giving it attention, advocacy, and that is what we have started. So we must thank New Central and Momani for the opportunity and allowing those who are viewing at home to see through the situation and know that you are not alone. The station is with you. There are professionals around the world who are also with you, and the world is talking about what you're feeling.
All right, thank you for that, Ifeoluwa. And I like that you did mention that we are already changing the narrative. Now, Salim, let's also talk about mental illnesses, especially the likes of dementia, for example. How professional are we in dealing with these issues, diagnosing people, and providing personnel who understand this problem? Because a lot of times, especially in Africa, we do not exactly see people who pay attention to those who have mental challenges. We just sometimes just classify them as, oh, this one is gone. There's no diagnosis, there's no therapy. we don't exactly have all those kind of things. So are we well trained or professional enough to deal with those kind of illnesses?
The challenges of Africa is multifaceted, and one of the areas has to do with the mental health area. Of course, those who are professionals have been well trained. However, the numbers do not fit. For each professional, the number of patients or clients available for you to attend to is enormous. And so people would be in some jurisdictions where they cannot access professional care. However, to be able to make sure that mental health reaches everyone, there's a need for us to do what we call the community mental health, where you train people in the community to provide the most basic of services in terms of prevention, in terms of management, before it is scaled up to professionals such as clinical psychologists or psychiatrists. But how do we do this? Like Ife mentioned, we need a lot of advocacy. We need to tell people. And, when we talk about mental illness, people always look at it as though we are talking about the severe or the profound one. Mental illness can be as mild as feeling sad continuously over days and weeks without you knowing what is happening. There's a need for you to put a break on yourself, do an introspection, and be able to resolve your emotion and accept how you are feeling. Denial most of the time and superstition have been engines by which mental health has not been progressed or has been stalled. Because if you believe that your illness or your challenge is caused by something other than the physical, then you seek services from those areas. And when that happens, it only delays and then magnifies the problem. And before you seek professional help, you might be severe and sometimes profound with characterized by sometimes hallucinations, suicidal ideation, suicidal thoughts, and sometimes the attempts. But all in all, the professionals are available. I do accept that in terms of numbers, Africa especially, we do not have the cohort of all the numbers that we need to attend to, but there are levels of care, primary, secondary, tertiary. In the primary settings in your community, there could be a mental health nurse. Here in Ghana, it happens. There could be someone who could teach you some basic skills of how to relax, how to calm down, how to deal with anger, how to manage sadness, how to grieve properly, so that you don't end up with so many challenges or distresses that become mental disorders, which are severe in later times.
All right, thank you for that, Salim. Now, Ifeoluwa, when we're talking about mental health challenges, a lot of people feel like mental health is only related to sadness. So if I feel sad or I feel downcast or dejected or depressed, then I have mental health issues. But so many people do not understand that the symptoms go beyond just feeling sad. I mean, it includes that, but it's not limited to that. There is also changes in your mood. There's also tiredness. It affects your sex drive. It affects your eating habit. Many people don't know this. So how aware are we of this situation, of these symptoms? Because a lot of people go through these things, but the fact that there is no sadness per se makes them feel like, oh, I'm still okay. I'm still okay.
Okay. So when we talk about mental illness and mental diseases, I teach a class in mental health law for professionals, for both postgraduate students and undergraduate students. And so when I bring out the data from the United Nations and the World Health Organization, I give them the 1 in 4 and the 1 in 8. So I tell them that if there are 4 people seated on a particular row, 1 out of those 4 or 1 out of the 8 either has an illness or a condition or a disease. So people begin to look at it a little bit more introspectively and say, okay, but I don't exhibit any signs. I don't have any symptoms. Does it mean that something may be wrong with me? If you check the International Classification of Diseases, ICD-11, you will discover that a list of situations and circumstances have been presented which may show what a mental illness is or things that are categorized as mental illnesses. And some people are still undiagnosed. So it means that whilst they have some of the symptoms that you have presented on the screen, some of them are periodic, hence the person doesn't find any reason to present themselves before a clinical psychologist like Salim or appear at a medical facility to say, I think that this is not normal, until there's a major incident in their life. I spoke to one of my colleagues who is relating with somebody who works with me and said, oh, I have a family member who has been suicidal in recent times. And although the person had had suicidal thoughts over a long period of time, they did not carry out that thought until when sometime recently, and it was not until they executed that they were now able to start pinning some of the symptoms or some of the actions that are directly related to such thought. So I think that it is important for us to be a little bit more introspective, a little bit more conscious, a little bit more aware. I was at a presentation earlier in the day on World Mental Health Day, and they spoke about a particular Nigerian musician who unfortunately has passed on, and people are now beginning to say, oh, maybe when this person was singing this, maybe when this person was saying this, could it be that something was already happening at that time? And that is the same thing for all of us. What is in their journals? What is in their poems? What is on their walls? How are they relating? What are the differences that you have noticed? And so there's a little bit more looking beyond just the surface. Fine shirts and lovely ties and suits. You don't have to wait until people are in the state, like you mentioned, or are out of control. There are some situations that require immediate attention or early diagnosis, and which will make treatment by professionals a little bit easier.
All right, thank you for that, Ifeoluwa. Now, Salim, back to you. Let's take a look at Ghana's structure when it comes to tackling mental illnesses and mental health issues. Now, a lot of mental illnesses are linked to substance abuse. So we can't exactly talk about one without talking about the other. So when we're talking about substance abuse, what bodies are actively working against, the excessive use of drugs in Ghana, Accra, or, what measures are put in place to curb the use of drugs?
I'll put it into three different areas. There's the preventive arm, there is the regulation arm, as well as there's the intervention arm. So prevention in the point that we have police officers or border patrols or immigration that ensure that illicit drugs do not come into the country or are not produced by persons to be sold or used. Then we have the moderation or the care, where if people have access to these things, how are they using it? Are they using it in moderation? If they are using it, what are they using it for? Is it for medicinal purposes? Is it for, because I think it's not only illicit drugs now, even pharmacological medication that are meant for some other illnesses are being abused lately. So how do you educate? Advocacy is one of the things. There are institutions that need to educate, like the National Drug Board and councils. They have to educate people. And then we have those who will do the interventions. When you have engaged in substance use, you have what you can develop what we call substance use disorder or substance-induced psychological disorders. Because if you are, say, psychotic, where you hear voices and you have delusions, we would not just say you have psychosis or schizophrenia. If there is a substance associated with it, it becomes a substance-induced disorder. In that case, they need to go through the process, whether it's medication, have to see a psychiatrist and go on the rehab, or undergo therapy to look at what distress or what pain were they not trying to numb, what experience were they trying to have where that led to the substance use disorder. But these are the three stages by which we can deal with substance use disorder. I just wanted to add something briefly to what Ife had said earlier when it comes to signs and symptoms and how people should know. As a person, you have different areas of your life, including personal, social, occupational, and other significant areas. Anytime you realize that your performance in any of these areas has dwindled or there's a challenge, you want to take a step back and reassess yourself. What could be happening? It might not be just a mood thing. It might just be sometimes physical illness, headaches, feelings of tiredness, feeling of burnout. Then it means that you either are not processing some information properly or you're avoiding it. When that happens, you want to start talking to someone quickly or seek professional care.
All right. Thank you so much for that, Salim. And I like that you did chip that in. Now, still talking about mental health challenges, there's a very unfortunate wave now of bullying amongst young children, like really, really young children. We see that in the Western world where you see an 11-year-old committing suicide because they're being bullied in school and they're not vocal enough to exactly tell their parents about it. Now, in this part of the world, I'm talking about Africa, we have children who are very vocal, who would say, Mommy, this person did this, this teacher said this to me, this classmate of mine said this to me. But we also have children who are not exactly vocal enough, and they cannot on their own handle such pressure. So it leads to, mental health challenges, which, like I said, is very unfortunate. Ifeoluwa, is there a solution to that?
Yes, there is. There are solutions to bullying, curbing bullying, and stopping the bullying. Institutions and establishments must be very, very firm on their bullying or anti-bullying policies. I was speaking to someone on a radio station this morning, and she said that the most scarring part of her life was when a senior in one of her secondary schools asked her to sleep under a bunk as a way of punishing her. So the person sleeps on the bed, you sleep on the floor under a bunk. And that moment had scarred her for up to 15 years. Now, one of the most painful parts for that person is how she believed that nothing was done to correct that situation. So if the establishments, educational institutions, groups, organizations, police, family members should be able to stand against bullying. We should not tolerate it. Unkind words, jibes, random talks, describing people by how they look. And that's why the theme for this year is on mental health as a universal human right. We do not discriminate against anyone on the basis of their health or on their mental health. Because a person looks in a certain way, because a person speaks in a certain way, is not justification for them to be bullied. And so groups, individuals, establishments, all of us must stand up to the bully and then protect the person who is being bullied. And then one other important thing is to raise assertive people. Assertiveness is a skill that can be taught. Assertiveness is a skill that can be learned. People who are different, either because of a disability or face challenges of inclusion, because of a diversity, because of things that they sometimes cannot even help, then they are now being bullied, and this affects their mental health. So if somebody is telling you that, oh, your head is as big as this, your legs are as small as this, why are you looking this way? Why do you speak this manner? Why do your eyes look like this? This person can feel very bad, either physically or virtually. And young people are at risk because of access of social media. And so we're going to ask parents, teachers to be more aware of what young persons are going through, and government with cyberbullying policies, mental health law policies, and the enforcement of those policies as well is important, so that anyone who attempts to bully will pay the price for it. And when people now report, they will be assured and certain that they will be protected by law and by their environment. So for everyone who is facing it, report, make a case, and don't just wait for people to report. Look through circumstances and situations, ask questions. Like Salim said, if there's a situation, you might not be the one who is able to do the self-introspection. Somebody may be looking at you and then see that something's going on with you. How are you feeling today? Ask questions that can help people also speak about their mental health. Let people use gauges. Give people color codes for them to be able to say, how do you feel today? Great, not so great, bad, not feeling good. Questions that you ask can help people to open up. And if you're somebody who is asking those questions as well, you'll be listening as well.
All right, thank you so much for that, Ifeoluwa. Now, very quickly, Salim, there's also the mental health trauma or issue that is brought about by sexual assault. Now, in some cases, there are people who were assaulted, in their childhood, and they can't exactly speak out because of fear or the stigma or whatnot. But there are other extreme cases, like what we see in DR Congo with the women in the IDP camps. They're sexually assaulted. They're threatened that, their lives are threatened. Some of them are even killed if they attempt to speak. In that kind of situation, how do we handle treating these women? How do we encourage them to speak up without putting their lives at risk?
That's quite a complicated situation, especially if after speaking up, they put their lives at risk again. So it means first we have to deal with the risk of they being harmed when they speak up. And then that becomes a humanitarian crisis. Our minds are right. So it means that people who work on human rights issues, other countries, the United Nations, we need to step into these places to say that let's put a stop to this. Let's put a humanitarian face to even wars so that vulnerable people, women and children are not affected. But of course, for sexual abuse, when it happens, of course, sometimes the victim now feels like they are guilty of some action. Either they put themselves in the harm's way, or they wore something that was not right, or they spoke in a certain manner, or they gave the impression that they were ready for it. So they therefore feel guilty and will not speak up. But now when there is the issue that if they speak up, they have the tendency to be harmed or killed, of course they can't do anything. The control moves away from them to those of us who are outside that situation to speak up against it, to drum home to everyone in the world that there's something wrong going on in those places and it needs to be resolved. But back to your homes and the places where you live, where there is no wall, and when people speak up, they will not be bullied. Victim blaming and victim shaming is one of the issues that stops people from seeking mental health when they've gone through trauma or sexual abuse.
Right.
So it's important people report to you, you listen without judgment and take their word for what it is. You are not the police, you are not the judge. They'll do their work when they get to court.
Right, really, really insightful session speaking on mental health. And once again, it's a good thing to see that we're celebrating this day and creating the awareness that it is indeed a human right that should be taken seriously. Ifeoluwa Yimika Bamidele, mental health advocate in Nigeria, thank you so much for joining us. Salim Wangabi, clinical psychologist in Accra, Ghana. Thank you, gentlemen, for being part of this show today.
Thank you for having us.
It's a pleasure.
Have a great